Hey, 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 Facebook family, what's happening? There is a lot going on in the world. Actually, I think that should be my signature statement. There's a lot going on in the world, or the world has changed a whole lot. Um, you have to forgive me. I've got a lot of different electronic stuff going on. And while I'm not a media man, it's like three different cameras. I'm trying to figure out how to work this out. But look, if you put in the group chat, chime in where you are listening from. That will be very helpful. And I will try to keep the sarcasm to a minimum. Just so you know, I worked last night. So when I've done it overnight, I'm a little more sarcastic. But I think that those of you all who have been rocking with me already know that about me. But if you could just drop in the chat where you are listening from, that would be extremely helpful. That would be extremely helpful. And we all heard, we all see that. Already know that. All right, here. Hey, Cruz, what's going on? How you doing, Mr. Cruz? Sandra Perry, what's going on here? Hey, the DMV. Whoa, hey, for those of us who are in the DMV, you see that we're turning into another hotspot again. So we've got to slowly work that out. Slowly got to work that out. But if you listen to some of the comments that were made yesterday, and I'm going to get into, no, I'm not. Yes, I will. One thing that Dr. Fauci has said in the last couple of days is everyone should keep in mind. He said something very subtle, and he shows his hand a lot. He said we will need to get a hold of this before it comes back north, because don't forget, start up here in New York, or start up in New York and now it's south. Just the fact he said before it comes back is a sign that we better get ready. We better get ready. I'm not saying that to scare anyone, but I just need to right size this, to set us up, to set us up. I forgot before I get started, I gotta say hi to everybody. Cruz was going. Hey, Cruz, you're not are supposed to talk. You know, I like what you're doing with social media. Princess here in Hampton. Oh, Princess, I see that Hampton. The Virginia area, it's kind of the numbers are kind of going up. Hey, Dion Charles, what's going on? Karen McPaul in Lorton, what's happening there? Dolores, hey, Dolores, you got the book. I haven't heard any comments. Dolores, you are a trip. You hit me up. First of all, thank you for that purchase. But you're supposed to give me some kind of feedback. What's going on? What's going on? Hey, just real quick. Also, before we jump into this, can you just drop in there something good that you know that's happened to somebody as it relates to COVID? Something good that's happened to somebody as it relates to COVID. It doesn't have to be long. Hey, my best friends survived. My best friend's negative. Just something good. Because in this day and age, in these days, which could be dark, and only dark if you allow them to be dark, we need some good news. Hey, I got Veronica, what's going on? Eve, hey, what's going on? Eve, HU Hugs, HU in the house. Oh, speaking of my HU family, this is not directed to anybody in particular. Gimme is not directed to anybody in particular. So everyone on this call, well, for those of you who I don't know, I'm a Hampton graduate, class of '89 Genesis. And there's about 6 of us who went to Hampton. I want to miss one homecoming since graduation. I'm that kind of Hamptonian. I'm a real one. The reason why I highlight that is because of this statement. Hey, for my Hampton folks, when you hit me up, especially if it is medical, and by the way, well, if you hit me up and it's something medical, it's better you just jump right into what you need or what the conversation is, because what ends up happening a lot is we spend about 5-10 minutes talking about my kids, talking about your kids, talking about what's going on in the world. Then it's time for me to go, and then you get to your question. Hey, I'm good. I'm not offended. Just get right to your question. Now, for those of you who didn't know me pre-COVID, just talk to your primary care doctor. Hey, it all works out. But for my Hampton folks, let's just get right to it, and not just Hampton. Anyone who I just knew pre-COVID. All right. Hey, my cousin. Here we go. We got some good news here. Jonathan Macmillan. Hey, Jonathan, why don't you drop a line in there in terms of how your son is doing? Jessica Foster from Waldorf saying her cousin recovered from COVID. That's a great job. He wasn't doing well at first. So congratulations. Tracy Reeves representing G2. Hey, that's a classmate in the house. Crystal McLaughlin, people need to be scared. My cousin just passed last night from COVID. I'm very sorry to hear that, Crystal. She was only a couple of years older than me. She just got off the ventilator. I don't understand. I am very sorry to hear that, Crystal. Jonathan McMillan saying Hampton Love from the Metro Atlantic area. Okay. All right. Hey, good job, Jonathan. Thank you. Got Cheryl Askew. Okay, everybody, this is how we're going to do it. Again, we're going to be a little sarcastic today. Well, I'm going to try not to be. But I worked last night and overnight, just a little more sarcastic. If you wonder if I look strange, it's because I've been working on this media thing. So there's like 4 different cameras going on. So I'm not sure which one to look at. But I am figuring this out. We still got about 2 more minutes before we start. Hey, somebody reached out to me, and I apologize. I thank all of you all who purchased the book. It did reach the bestsellers list, so it's my 2nd bestseller. So I'd like to thank you all, everyone on Facebook, my Hampton family, and all those throughout my life who have supported me. So I thank you very, very much. I know I'm acting like I got some kind of Oscar or something. But seriously, no, I did want to thank you. A few housekeeping things. People have asked me, I said that I was going to give you a graphic as it relates to, or a outline as it relates to things you should consider if you're going to send your kids back to school. It's done. I'm just waiting. I just got to find someone. If anyone's good at ClickFunnels or anyone's good at setting up a lead magnet, I got the graphic. I just got to put it into a lead magnet. So if you're good at that, please reach out. But it will be coming in the next 48 hours. And let's get started. Speaking of the book, Train Your Mind in Split-Second Decisions. One of the concepts in the book is talk about decision fatigue. Well, we're rolling. Decision fatigue. What that is that as the day goes on, your brain gets tired. It gets tired as a result of the multiple decisions that you have to make. We already talked about that we make about 35,000 decisions every day. But as your day goes on, the more and more decisions you make, the tired your brain gets. And so therefore, when it comes to the important decisions later in the day, you're not able to synthesize that information as much. And therefore, you tend not to make the most optimal decision. Why is that important? It's because the decisions that we have to make around COVID, especially when we get news that comes out later in the day where our decision-making capacity may not be as good, we've got to have a structure, a platform, a strategy for dealing with that. And let me tell you what I mean by that. Let's start with the sarcasm that I start off with, which was, did you take your anti-COVID medicine? Did you take your anti-COVID medicine, your hydroxychloroquine? That was sarcastic. Hopefully the answer is hell no. I can say that. I put it down. This is one time. This is medical advice. You all know I'm really kind of skittish about that. This is medical advice. Whatever you do not take that hydroxychloroquine. And I recognize that our president tweeted that out, and there was a doctor who was saying that. What can I say? What I can do is I can give you the evidence. A few different things. The New England Journal of Medicine, we're talking about hydroxychloroquine and chloroquine, which have been touted as treating COVID patients and preventive medicine. Again, this is medical advice. Do not use chloroquine and hydroxychloroquine as preventive medicine for COVID, or use it to treat your COVID symptoms at home. That is medical advice. I'm going to give you evidence why. The New England Journal of Medicine, let me back into it. In order for a medicine to be, let's make it simple. In order for us to approve a medicine for a certain use, it's got to go through clinical trials. It's got to be approved. It's a process. Hydroxychloroquine and chloroquine have been around for many years. So let's get that clear. In fact, I've taken it. Not as it relates to COVID. A few years ago when we went to Ghana, I took it for malaria. So it has use. It's also used in autoimmune disorders like lupus, SLS, rheumatoid arthritis. So it's got a medical use to it. But outside of that, it does not. it's got to be approved. Now, let me tell you, two things happen. First thing is that the FDA, because of back in May and June, back in April, May, it said, hey, we heard all this stuff about hydroxychloroquine and chloroquine, and the president pushed it. He pushed the FDA, so they approved it for emergency use for COVID-19. They approved it. We were using that in the hospital. But then this is what happened. On June 15th, the FDA, which is our president's organization, reverted. They said, hold, do not use chloroquine and hydroxychloroquine for COVID-19. It has been found not likely to be effective and can be harmful. That was our FDA in June 15th. Now, NIH in June 20th of 2020, they were conducting a study. The results were a human study. The results were so bad, they had to stop the study. And then, just to bring it home, the New England Journal of Medicine, on July 23rd of 2020, they did a small study and presented it in an abstract in the New England Journal of Medicine. They looked at 667 patients. You know how effective the hydroxychloroquine was, and the chloroquine and the zithromycin monopathy? Zero. There was zero. It was zero. It was not effective at all. I highlight this because all these videos are going around. Just because someone's has on a white coat doesn't mean that they have sense. Medicine is like any other industry. In law, there's some fools. There's some congressmen who are some fools. There's some doctors who are some fools. I'm not calling anybody a fool. I'm just simply saying, just because someone has on a white coat, you cannot trust them. There's a preponderance of evidence that this has not been shown to work. Now, what's going to happen is, let me prepare you. Someone's going to give it to 4 or 5 people and say, oh, those 4 or 5 people work. It's got to be helpful. Well, what we don't know, which is why you have to have a control studies, would those 4 or 5 people have gotten better? I'm going to beat you to your next question. Your next question is, well, is it going to hurt? I'm scared. 150,000 people gone. Is it going to hurt? The answer is yes, it will hurt. Let me tell you about the side effects. There are multiple ones, but the main side effect, it causes sudden cardiac death. Say it with me. Sudden cardiac death. And in fact, if you understand what I'm saying, I need you to give me a few thumbs up, something, because it's real quiet in here. So I don't know what's going on. I don't know if people are listening to me. Okay, here we go. Yes. Hydroxychloroquine and chloroquine are harmful. Board certified emergency medicine physician who's practicing last night. I'm not somebody who's on the news who just has on a white coat. For those of you all who rock with me, this is what I do. And I was talking to a classmate, my big sister from Hampton this morning. She's key. She picked up on something. For those of you all who follow me, okay, all right, follow me just real quick. Choose who you're going to listen to. But who you listen to, they should be an expert. And it'd be nice to have a license attached to their name. The reason why a license attached to the name is very important is because if I say something outrageous and crazy, you all may not do anything, but I'm going to get a letter from the Maryland board, from the DC board, and say, hey, can you come in and talk about this? There's a higher authority that controls my license. You say, why is that important? Is because choose who you're going to listen to, because the message that they give you is very important. My big sister this morning, she said, Geoff, we all listen to you. We learned that when you say, we learned that you should really listen when I say, this is what me and my family are doing. And the reason why I've got to parse it that way is because sometimes, I give you all evidence-based medicine. And that's what you all rely on me. But when I say this is what me and my family are doing, that's just what we're doing in this household. Anyways, back to it. So hydroxychloroquine and chloroquine can cause a sudden cardiac death. What that means is you're just sitting here walking, boom, you die. It's called QT prolongation. We won't get into that, but it causes sudden cardiac death, QT prolongation. So yes, there is some risk. Some of you are real smart. You said, well, why do you take it for malaria and these autoimmune disorders? Because It doesn't happen frequently, but the more number, but a lot of people don't take this medicine. But the more number of people who take it, the greater likelihood that it can happen. And then those people who are taking it, they have a use for it. Let me summarize everything I've just said this way. There is no anti-COVID medicine. Do not take hydroxychloroquine, and do not take chloroquine. That is medical advice from board-certified emergency medicine, Dr. Geoffrey Mount Varner. And for those of you all who have rocked with me, you all know I rarely give medical advice. And just a few updates here. Oh, the vaccine. The vaccine's coming. The vaccine's coming. I'm not involved in the research. I just simply read about what's going on. The prediction is March of 2021, maybe February. I say that to say, stay on high alert. Stay on high alert. It's very important that we stay vigilant, because 150,000 people are dead. It's very likely we're going to get to 300,000. Let's pause, deep breath, regroup, because that's a scary number. But let me just say, we do not have to get this. Social distancing, wearing our gloves, wearing our masks, that's absolutely key. That works. You all already heard me talk about vitamin D. If you are darker skinned, or vitamin D deficient, which most darker skinned people are, or if you're elderly, it's extremely important to talk about vitamin D. We'll do another talk about vitamin D recently, but that's an extremely important one. But look, this thing is still moving. It's moving fast. And the biggest spreader of them are young people. Young people between the ages of 18 and 34. Young people between the ages of 18 and 34. And unfortunately, we see that unlike in other countries, we've had a few young people die. And the reason why I highlight that is that young people think that they are immune. Young people think that they can't get sick. Well, they're right. They have it's less deadly to you, but you get sick as well. When you get it, you can get sick. And let me tell you what the newest literature is saying. And parents, please share this with your young folks. Is everybody ready for this? If I get a few, okay, everyone's ready. Hey, Leslie says she rocking. Okay, here we go. 35% of people at ages 18, 35% of people who tested positive and did not need to go to the hospital, meaning that they stay home and they self-treated. 35% of them were still having symptoms 2 to 3 weeks later. 35% of them were still having symptoms 2 to 3 weeks later. Among those with 18 to 34 with no medical problems, 1 in 5 have still not returned to their baseline health. 1 in 5, those 18 to 34 who had no medical problems, 1 in 5 had not returned to their usual baseline of health yet. I say that to highlight young people. You may think you are immune, but you're not. You just have less of a risk of dying. And if and I would just say that because you're the most infectious group of people and you're passing it the most, it is so important for you to wear your mask. And then the other part that I want to talk about, before I get there, I also want to thank, I won't mention the lady's name, but thank her as a result of my live. She had me put me in contact with a few people in her company. I'm doing some trainings for them. Just so you know, I do this emergency medicine thing, I do this COVID thing, but my other arm is split seconds. I train executives how to make executive decisions or how to make split second decisions. So please reach out if you have a training need. We've also included an arm called blind spot training, executive blind spot training. Now, you all know what a blind spot is. So just anyways, reach out to me. The next big thing that is very, very important to highlight that I don't have for you today, but it's coming. Is your child going to school? Is your child going to school? I will have the graphic for you soon, but the one highlight that's very important for me to say to you is be flexible with your decision. If this thing moves back up north, for instance, Maryland is becoming a hotspot again. As this thing moves, You have to weigh what's going on within your community. There's two pieces of data that I just need to make you aware of, just to add to your decision. And by the way, I want to be so crystal clear, team, so crystal clear. If you're put in a position your child's got to go to school, don't feel bad. I mean, it's not completely unsafe. It's not completely unreasonable. In full disclosure, my children go to school in Prince George's County. They go to private school. Prince George's County has decided that they're going to close the public schools down. And during snowstorms and all that, the school, my kids' school usually followed the Prince George's County school. Well, this year they said to us, well, we will wait and see. Long story short, after a few emails and conversations, it became clear to me that the fact that we're paying tuition is playing a role in our kids going back to school. And by the way, I don't think that's unreasonable. Why do I not think that's unreasonable? Because there's not one set answer to this. There's not one clear answer to this. These are moving parts. That's why I would encourage you, when I get this graphic out, check it off, add your parts to it. But two big considerations. I told you all when I'm working overnight, I tend to ramble. Sorry about that. What were the two big considerations? Oh, two big considerations. Those ages 10 to 17 actively spread the virus just as bad as adults. 10 on up to 17 spread the virus just as bad as adults. That's just a data point. The other data point was, I've not been able to find any documented case where someone under the age of 10 who was positive came home and spread it to family members. Those are just two different data points. What do you do with those? It depends. All right, everyone, that is it. This is Dr. Geoffrey. Hey, please follow me on YouTube at Dr. Geoffrey. If you would like a consultation, please reach out to me. If you have an organization you would like for me to live into, we do COVID as well, but we do executive trainings. We do split-second decisions trainings for executives as well. Now we will get into the questions, everybody. Let's get into, again, my summary point. If something happens to me as I walk out this door now, and then I'm done, then I'm going to take questions. Choose who you're going to follow. Make sure they've got some sense. I use the CDC, WHO, academic journals, and a listserv of physicians that I am on. I use that currently. I do not, all of you all used to send me that social media stuff. I'm glad you don't. The reason why I decided to address this issue, just on a side note, my daughter sent it to me in terms of that little video that Trump sent out. By the time it gets to her, it means it's widespread. So I said, let's just deal with that. And that's it, team. Let's take some questions. Hey, here we go. Eva. All right, everyone. All right, Jonathan. Jonathan says, my son is doing well after returning from the trip. Okay, cool. I'm glad, Jonathan. Veronica. Hey, thank you, Veronica. G2 classmate in the house. Dolores, my apologies. Dolores, you don't have to apologize. It's cool. It's okay. It's okay. Seems that everybody has a price. Chump is scrounging the pantry of black. Okay. All right. So, I will do politics, but I'm not. But get your COVID kits ready. Your COVID election kits ready. Real quick, I went over this about 3 weeks ago. You should go ahead and try to obtain an N95, gloves, and hand sanitizers. Have that, put it in a plastic bag, and on voting day, you can go vote. No matter what's going on. If you have an N95, you have gloves, you have hand sanitizer, and you can socially distance, you can vote. There's a business idea for somebody. All right, here we go. Denise Limbeck, sudden cardiac death. She asked, what is sudden cardiac death? Selena asked, what's sudden cardiac? So she's talking about the side effects. Well, one of the name complications of taking chloroquine and hydroxychloroquine, sudden cardiac death. Sudden cardiac death is your heart just stops beating and you die. That's sudden cardiac death. You will not die if you're sitting there in a hospital and you go out, because your heart goes into a funny heart rhythm that we can shock you out of. And just as an update, because there are people still talk, they still instant message me, and they still instant message me. I worked last night. We are still sending COVID patients home. Nothing's changed. You come in, you're COVID positive. Well, you come if you come in, you're COVID positive means you got tested someplace else because we still don't test in the ERs that I work in. But if you have symptoms and you're stable, we send you home. Okay, and you go home, and within 14 days you are better. I highlight that to I say yes. The recommendation is to stay home, but talk to your primary care doctor because there are worsening symptoms, and we should do another live on. We should update just on these symptoms. Here we go. Jacqueline says a license attached is key. Yes, that is real talk. My father would say to the doctor, the white coat does not impress me, and I would cringe. My father was a wise man without a junior high school education. All right. Crystal Taylor, what's going on, Crystal? That's my girl. What's going on? Fitness is not a game, Crystal. Selena asked me a very personal question. You contracted malaria. You're not supposed to ask me that kind of personal question. No, when you go to Ghana and these other countries, you've got to take. It was used as a prophylactic medicine. But thank you very much, Daryl. I do a DNA supplements or D3 K2 boost. Okay, all right. Should we go back to school in fall? Thomas Goysham. Okay. So how long do the symptoms last? Selena Threat says, how long do the symptoms last? It depends. We used to say from 5 to 7 days. Follow me on this one, team. Follow me on this one. The symptoms are known to last for longer. But the longer your symptoms last, the less likely that you are at becoming worse. Meaning that if you get to the 12, 13, 14th day mark, and you have not worsened and needing to go to the hospital and needing to go to the ICU, you're past the immediate bad mark. But your symptoms may last for several weeks. Hopefully that makes sense. Very good question. Very, very, very good question. Darcella, I finally catch the segment live. Okay. Hey, what's up, Darcella? Yes, home for patients too. Some to rehab. Good morning from California. Thank you very much for this. You are welcome. You are welcome. Okay, question about the test. Let's talk about this test real quick. We've already done a few lives, but I'm going to make it real simple for you. There are two tests. One of them is the swab. It's the antibody swab. It's the antigen swab. It tests if you have active virus. That's the one that most people get. We're going to talk about that one in a second. The other one's the antibody swab. They draw your blood and tells you if you have antibodies. If it's positive, which is it means you were exposed in the past and you now have antibodies, which means that it is believed that you cannot immediately get COVID again and that you cannot pass it to anyone else. Let's go back to the swab. Here's the important part of this one. The swab, it tells you if you have active virus. It tells you, do you have the disease right now? Now, here's the kicker. This is the part that I need people to understand because I deal with this in the ER a lot. The swab only tells you, do you have the disease at that moment, at that time? Here's the second kicker. That's only 70% accurate. It's only 70% accurate. If it's positive, if you get a swab and it's positive, that's 99.9% accurate. But if it's negative, it's only 70% accurate. The reason I highlight this, I get several patients who come to the ED. Say, oh, I just got swabbed and it was negative, but I have a cough and a fever and I don't feel well. Because you got COVID. You very likely have COVID. We diagnose them with COVID and we send them home. What is my point? Just because a test tells you something, like a swab, and you still have the symptoms, treat yourself like you have symptoms and definitely talk to your primary care doctor. Do you understand? Because let me know if that makes sense, because it's an important, simple concept. Give me a few thumbs up and let me know if that makes sense. Krista, what's going on? Krista, when we have another class meeting? Here we go. All right, here we go. Takesha, home for outpatient, good information. Hey, I'm glad you enjoyed it. Go ahead. My stepdaughter is traveling to Florida. Ooh. My stepdaughter is traveling to Florida. I've told her when she returns, she has to quarantine for 2 weeks at her mother's house for 14 days before she can go home. Is this adequate? I'm not giving medical advice, but I will share some insights. Because yes, it's very adequate. She should quarantine. She should quarantine for a while. And someone should talk to her about her decision making. I don't know why she's going, but there's some decisions going on. Speaking of which, if you hit the bit.ly attached to this, I would encourage you, for those of you all who have not purchased it, I will put it in here, but I would just tell you, for her to go to Florida, which is the hottest spot, and Mom, I'm not trying to scare you, it's the hottest spot in the entire world. If there's any way she could not go, I would encourage you to like not let her go. Florida is the epicenter of the world. It's the epicenter of the world, and the positivity rate is greater than 5%. The positivity rate is the number of people who test positive of those who are tested. Ideally, you want to see that under 1%. Under 1%. Theirs is 5.4%, something very high. Be very careful. But for those of you who didn't get a chance to purchase or you want more information, I dropped the link in there. A few more questions, then we will get out of here. Michael Garrett, Michael Gar, what's up, Mark? What's up, Mike? All right. I have my entire household taking vitamin D3, any other supplements, zinc, vitamin B, C, or K. That's a very good question. Ida Henderson writes, I have my entire household taking vitamin D3, any other supplements, zinc, vitamin C, or K. As promised, I only give you all academic peer-reviewed data. The only vitamin that supports that is vitamin D. If you have an article, an academic peer-reviewed article that you would like to see me, I would send me. I would be more than happy to read it. But Dr. Geoffrey is only recommending vitamin D, and I highly, highly recommend vitamin D. And I will even say this: the darker skin you are, the more important it is for you to take vitamin D. All right, before we get off, someone drop in the comment why I said it that way. The darker you are, the more important it is for you to take the vitamin D. Somebody just drop in the comment in 2 or 3 sentences, tell me why I said that. And also, the older you are, older people, it's very important for you to take vitamin D as well. Why? Because the skin changes that come with the old age of black, white, purple, and green people. Your skin is less efficient at converting sunlight to vitamin D, and 90% of our vitamin D comes from the sunlight. All right, here we go. Nobody dropped that in there. Sitting in my classroom. Oh, Dale Grant. Sitting in my classroom for the first day of school here in the Atlanta, Georgia area, feeling a little anxious. Thanks for sharing my knowledge, brother. Hey, Dale, proud of you. Be strong. Dale, I'm proud of you. Hey, let's give Dale and all the teachers on this line a few hearts, a few thumbs up. I'm going to drop some in there my daggone self. Hey, we thank you all for what you do. We thank you for teaching our kids and putting yourself at risk. And in return, parents, make sure, seriously, real talk, because I got kids. If your kid has a fever, keep that child at home. Don't do that Motrin Tylenol thing. If he has a cough, keep that child at home. And make sure your child understands that they wear the mask. Just real talk. Hey, teachers, thank you very much for that. Chris McLaughlin, what couldn't possibly go wrong if a person is well enough to be taken off the ventilator to an oxygen mask, then has a bad turn? This is common. It's not very common. And Chris, I'm very sorry to hear about what happened to you. But there's a host of different things that could be wrong. And there's a host of different questions that probably need to be answered before I would even comment. But I'm very sorry that you got to go through that. But it's not very common. But it has happened. I'm very sorry about that. Krista, my class president, Krista, we need a class meeting here. Here we go. Why do some people get cheek swabs? As you know, that is a great question, because everything says that it's the back of the oral pharyngeal cavity that's most important. Some of these companies are using the cheek swab. I've not done enough research, but I know a lot of virus sits in the very back, which is why it's very painful when they go through your nose and go all the way back. I'm not sure why they're going through the cheek. I'm sure there's some technical reasons that's outside of my scope. Very good question. Very good question. Takesha Ford, I look forward to the discussion on the symptoms of COVID-19, both old and new, especially with children heading back into the schools. I don't agree with and continuing increase of COVID-19 in hospitals not having enough room to support patients and send them home. So what your comment about? She says, I'm continuing to increase COVID-19. Hospitals not having enough room to support patients and sending them home. We are indeed, yes, let there be no doubt. We are indeed in a crisis. And I don't mean to scare you, but let me put on my emergency medicine hat. We have been reviewing our training. We do mass casualty training. Mass casualty is real simple. When the system's overwhelmed, whether that's in the field, we go out to where there's a big incident, or it's in the hospital, we have mass casualty protocols, and it's just that. It's one of the few. You all say that doctors like to play God, and we don't really get to play God. It's one of the few times that you're almost playing God. You've got some criteria. Mass casualty is real simple. We have a system for how we classify you. If you are sick, but you will be all right, you go home. If you're sick, but you need some more meds, but you need additional care, and with that additional care, you may make it. Then you go into special category. We will probably see you. But if you're sick and you're going to require a lot of resources, and you still may not make it, that's where Texas and Florida are. We make you feel comfortable. I mean, we give you something to comfort you, and you don't get all the care. Why? Because there's other resources. And then there's the top category, which is you're still alive, but you're probably not going to make it no matter how much resources. We give you something to make you comfortable. I don't say all that to scare you. I say it to say, yes, we are in a crisis. What's going on in Texas and Florida can easily come back here. I don't say that to scare you. I say it to prepare you. Vitamin D, exercise, socially distance, washing your hands. When you're in a crisis, it requires us to make crisis-like decisions. If you're making the same decisions that you made this time last year, you're missing it. We're in a crisis, and it requires us a different level of thought. All right, here we go. Lisa Terry. So Takesha, I promise you the next 7 days, I will do an overview of the symptoms, because the symptoms have changed. The symptoms have changed. Because dark people do not absorb. Okay, Darcella Allen, good job. I made the statement. The darker you are, the more important it is for you to take vitamin D. Darcella Allen asked the question because darker complected persons do not absorb vitamin D as well. Excellent answer. Real quick. The darker you are, the less efficient you are at converting sunlight to vitamin D. The less efficient. So the darker you are, the more you need to be in the sunlight. And the darker you are, the more likely it is that you're vitamin D deficient if you're not in the sunlight. Therefore, it's very important for you to take your vitamin D. But don't forget, because people are getting caught up in these supplements, the most important thing as it relates to the vitamin D, the most important thing you can do is get out in the sun. Get out in the sun. And get out in the sun and exercise. Why? Texas and Florida, the newest data are showing us obesity is a significant risk factor for negative outcome as it relates to COVID. Obesity is a significant risk factor for negative outcome as it relates to COVID. It's a significant risk factor. I don't say that to scare you. No, I don't. I say to say, given that COVID's going to be, well, I don't say that to scare you or to shame you. So anyone who's overweight, and I got about 8 COVID pounds on me, anyone who's overweight, follow me on this one, because this is a compassionate statement. Anyone who's overweight now, and we know COVID's going to be here, you start to lose weight now. And I don't have an article to support this. I do have an article that supports obesity is a risk factor for negative outcome as it relates to COVID. I got an article for that. So that's factual. This is me just being practical. So follow me. There's no data to this. If obesity is a risk factor, I am of the belief the less obese you become, the less of a risk factor it is. Follow me. COVID's going to be here for a while. You can start to lose weight right now. You can start to lose weight right now, so it's less of a risk factor. And how do you lose weight? Working out. Why is work? How does that even help? A, you're out in the sun. B, you're working out. C, you are reducing stress from your working out. Boom! It's a triple threat game changer winner. That's just my 2 cents. All right, we're gonna roll up out here in a few minutes here. Hey, anybody have any quick questions for? Yes, it's a few friends who have passed away. Hey, Thomas goes, I'm very sorry to hear that. A few friends. Yeah, I'm very sorry to hear it. Yolanda, here we go. Yolanda Hagley in Florida. Please confirm the death rates for positive COVID cases. Please reaffirm the death rates for our current treatments helping the worst. Had a 9-year-old that died suddenly from COVID. Heard about that. Local comments were to get to the hospitals as soon as symptoms present. So I'm not doubting you, but I've never heard any, especially, and Yolanda, you're in Florida, and you just said that they're telling you to go to the hospital as soon as symptoms present. I'm not in that area, but that's completely different from how we do it here, especially when it was bad here. Because if everyone goes to the hospital as soon as they get symptoms, that overwhelms the system. And don't forget, the whole goal was to slow the curve. I mean, was to slow the slope of the curve. I know you get this. Slowing the slope of the curve was not to give us a cure. It was to keep from overwhelming the resources in the ER, meaning that those who are not sick, we don't want you to come to the ER. Why? It overwhelms the resources. Therefore, I would encourage you to make sure that information that they're giving you in your local area is correct, and then talk to your primary care doctor. I can tell you what we're doing in my family if someone gets COVID, and that is we're starting off at home. They have an advantage. I'm here, and if I'm the sick one, I know what's going on. But if you have worsening shortness of breath, if you have persistent chest pain, bluish lips, or altered mental status, you get confused. Those are, according to the CDC, those are all reasons to go to the ER. But short of that, I would just be very careful about overwhelming your healthcare system. Pamela Morgan, no, not a master. Hey, Doc, sorry, what's Alexander? Where you been? Oh yeah, I hear you. Hey, I see Melanie. What's going on? Here we go. Crystal, let me know. This is a joint effort. Okay, Rick. Hey, what's up, Rick? What's going on, friends? All right, here we go. Rick has a very good question, and then we're going to jump out here in about 2 minutes, people. Rick Reef, friends of ours were tested for COVID-19 with finger prick tests. They received the results in 15 minutes. Fortunately, all negative. So the finger prick tests, as far as I know, those are helpful. But keep in mind, there were 7 companies that were approved for this, and what we're finding is that not all their tests are as accurate as they say. And in fact, in the American Physicians Monthly, it talks about the inaccuracy of these tests. So that wasn't helpful, but it just gives you a framework for how to look at it. But I can tell you this: if they tested negative and they don't have any symptoms, there's a good chance it's negative. But if they're tested negative and they have symptoms, they have COVID. Oh, wow. The biggest thing I can tell you, it is so important to get a flu shot this year. It is so important to get a flu shot. This will be a bonus for like watching me today. Do it early, do it as soon as you can, do it fast. Why? Because you will soon see the CDC, you will soon see all the government agencies pushing for flu shots right away and or soon. And it's very important. Let me tell you why from a clinical point of view. When you come to me in the ER and you've got signs of the flu, which are consistent with the signs of the of COVID, the tie goes to COVID. I diagnose you with COVID. I give you a work excuse for 14 days off of work. Let me be crystal clear here. Let me be very clear. It's very difficult to tell the difference between COVID symptoms and flu symptoms. Very difficult to tell the difference between COVID symptoms and flu symptoms. Therefore, try to get the flu off of the table. Meaning that if you have a flu shot, it's less likely that you're going to get the flu. They're really pushing for the flu shot, which means they're probably going to run short. I would encourage you, you and your family should go get a flu shot as soon as possible. As soon as possible. That is going to be very important this year. And if you get the flu and it's bad, you don't want to wind up in the hospital with the flu in the COVID environment. Now, that was worth its weight of gold today. But a lot of what I said today was pretty good. Here we go. My daughter is 8. They're offering virtual academy for parents who wish their children home. That's the option I've chosen. Although they are not Spurs, I prefer she not contract it because I'm still concerned about long-term effect. That is very reasonable. That's very Dolores writes, what a person with G6, it's a G6PD deficiency. I don't know how COVID impacts that, but I've been asked that before. And I think that there's an article out there about it too. Lonnie and Stan, I'm trying to drop my weight and keep it up. Hey, don't just try it, drop it, and keep it up. Hey, I'm gonna tell you how I put on my weight. How much we got time? We are gonna get off here soon. Alcohol at night causes people to put on weight. It's not just the carbs; it's the alcohol too. Why? Alcohol retards fat breakdown. In other words, alcohol keeps your body from like breaking down fat. One of the clearest and easiest way to not gain weight is to decrease your alcohol consumption. Very good, Lonnie. Appreciate that, brother. And and don't forget, for those of you all listening, we got about 2 more minutes, then we're done. If you have an organization that you would like me to like train, reach out to, we can even start off in like COVID space. But what we do is we teach executives, we teach people, we teach leaders how to make split-second decisions, how to make decisions under pressure, how to make decisions when it's an emergency, and if you're wrong, how to respond to that. All right, we're almost done here. Lisa Terry writes, are there any vitamins I should take besides LFC? The reason I ask is I would encourage you. Wow. I would encourage you, Lisa. That's well outside my area of expertise. So I would encourage you to talk to your primary care doctor. I would really encourage you. Hey, in these last 2 minutes, if someone could drop 2 or 3 things about something good that's happened to them, and then let me end it with this, because we're going to end this soon. We're going to end this soon. Here we go. Thank you very much. To Keisha Ford, thank you very much, because I know the storm is coming in regards to the situation. Hey, the storm is coming, but look, I don't want to sound like, like Disney or anything, but because we know the storm is coming, build your hut now. You know it's coming. It's probably coming back to the north. I have no medical knowledge about that. I have no data, but I have a gut. It's coming back north. Make sure that your body and your family are as healthy as possible. You have the supplies you need. You have what you need at home, so you can work from home as well, because many of us got caught out there. So make sure you are planning, thinking this through. And in the end, all right, here you go. Michelle Austin. I don't know anything about that. I don't even know how to pronounce that. So Nichelle, I'm sure it's a good comment. I just don't know anything about it. Are doctors testing if they have symptoms before they send you home? So Yolanda writes, are doctors testing you hopefully your primary care doctors. In the ER, we are not, in this area, we are not doing COVID tests. I'm going to tell you why. It doesn't help. If I'm going to send you home, and I have a packed ER, taking that test just takes more time. And there's still a shortage of tests. The turnaround time for the test is still really long. But every jurisdiction, every area does it differently. Now, in the end, everybody, I know this has scared some of us, but follow me on this one. In the end, this is all going to be all right. I'm not a fluffy dude say, okay, because I said it. Oh, follow me on this one. And by the way, if you are not religious, or if you don't have a higher being, what I'm about to say does nothing for you. You can tune out now. Thank you for listening. I appreciate you. But what I'm about to say, you're just not going to get. You've got to already have a higher authority. Everything's going to be all right for 2 reasons. Well, actually, for those of you who don't have a higher being, do not tune out yet, because I do have something for you. Think about a time in your life when it was difficult, when you actually were questioning when that was really going to work out. We've all been there. Let's not front. Give me a few stars or a few thumbs up, because you all usually leave me out there. If you've been through something where you had some questions, you weren't quite sure you were going to make it, we've all been through it. Let's just admit it. And the fact that you're on this call now means that it worked out. It means that it worked out. Meaning that there's always someone who's going to take care of us. There's always somebody who's going to take care. As evidenced by when we're going through something now, I mean, in the past, it worked out. This will eventually work out too, but we've got to maximize. We have to help it work out. We've got to do our part. Now, if that doesn't work for you, If that doesn't work for you, if your numbers do, you don't have a religious bent to you at all, that's all. That's cool. The data still supports me saying it's going to work out. Why? If you've got a child who gets COVID, 99.9% of children do just fine. And of those 0.0001 who did not do well, they had significant pre-existing conditions. And then 97.2% of adults do just fine. 97.2. In other words, everybody, the data, God, it's on your side. And I get some people have already experienced some negative loss. I'm very sorry to hear that. But for those of us who are like still here, we can still make this all right. We've got to maximize what we can do as well. And hopefully, for those of you who have listened, who have rocked with me, I encourage you to be ambassadors of education. Go out there, share what you've learned. Say, hey, do you know you need to take your vitamin D? Or hey, do you know why masks? Share. Because what I tell you is guaranteed knowledge. It's guaranteed knowledge as what's up to like date now. So be ambassadors and go out there and educate, because the only way we're going to beat this is wearing our masks, socially distanced, and gloving up and washing our hands. Hey, everybody, this is Dr. Geoffrey. We're about to get up out of here. I thank you all very much for listening. And Ronnie, all right, Lonnie, I got one more. All right, Lonnie, crystal tip. I'm taking mine when you take yours. I'm taking mine when you and your family take your Greg. Who? You should be important vitamin D, important shot. Thank you very much. Thank you very much. Spray the correct information. Yes, spray. Yeah. I'm just looking. One good thing that happened to me is that my ADHD, high functioning autism daughter no longer. Oh, okay. Oh, got some good news here. All right, here we go. Rita Rogers writes, one good thing that happened to me is that my ADHD, high functioning autism daughter no longer needs her meds because she doesn't have the triggers that she had at school. Hey, everybody get some thumbs up on that. Everybody get some thumbs up on that one. Congratulations. Now that is great news. That's the kind of stuff that make people feel better. Good job. That's the kind of stuff that make people feel better. Very good job. Very good job. Here we go. All right, everyone. Thank you very much. Be safe. Do something kind. Reach out to someone, and you will hear from me in the next 48 hours about the recommendations and the graphic for the schools. And do something kind for someone. Thank you very much.